Hey, Dr. Ben Lynch here with Dr. Jess and Dr. Eric Balcavage, and excited to announce that the SHI Forum is actually live and functional. And it's functional because we have these two great minds on it frequently, looking for questions coming from you to help you out. Because we have these great seminars, we have fantastic conferences, we get together, we learn, but we leave and we go separate ways. You go to practice, you go to apply things, you get stuck with a patient. Where do you go? You need knowledge now, you need to figure out what to do, you need to share your stories. So where do you go? You go to seeingall.org, and once you're a member there, you can go to the forum and you can plug in your case study, your case questions, or just share some information. And Dr. Eric and Dr. Jess will be there to help you out. So Eric, thanks for being there and helping people out, and it's been wonderful working with you for quite some time now. And thanks for being there to help these people get the information they need.
Well, thanks. I think it's really important that we give everybody that we're starting to teach and give information on methylation and the pathways and the planners a place to go, or that they feel comfortable they can ask questions and get some answers quickly. There's nothing worse than learning all the stuff and then when you get stuck not having a resource. And so both Jess and I, our goal is to help as many people as often as possible to get some information back. We've both been working with methylation for quite some time, and we've had our ups and downs and had questions of our own that we've needed help with, and we decided this is getting the forum up and running is probably one of the best things we could do to help out our fellow practitioners.
Excellent. And Jess, yes, we've been working for quite some time as well, and hashing things together back and forth with patients. As you know, as long as I've known you try to figure it out as well. So thanks for being there on the forum as well.
I appreciate it. I'm going to enjoy answering the questions. I agree with Dr. Eric that, we take various courses. We start concentrating on just the SNPs and we forget about the entire person. And it's easy when you're taking courses to kind of concentrate on one area, and you can get into that analysis paralysis type thing. But if you have someone to be able to ask questions of and get good, solid, experienced answers, you'll be able to put those puzzle pieces together rather quickly, and you'll shorten your patient's healing time. So that's the reason we're on the forums, and we're looking forward to answering your questions.
Excellent. Well, thank you guys both. And again, to access these two great minds on the forums, to ask your case study questions, you go to seekinghealth.org. And this forum is available to health professionals and memberships through the membership. So just go there, acquire a membership, and once you do that, go to your dashboard, log into the forum, and post away. And anytime you have a question regarding patients or mechanisms or something about the pathway planner or any supplement that you use or looking for supplements or tests, ask away. And if Jess and Eric don't have the answers, then they'll try to figure them out, or we'll work on it as a group and try to figure it out. And there's other doctors on there as well. So thanks for your time. And Eric, anything else to add?
No, I think the most important thing is that there's no question that shouldn't be answered. If you think it's a stupid question, I should know the answer, ask the question anyway. We're all going to learn from the experience. Sometimes something that seems like you can't find an answer to, somebody else may look at it and know that answer just because they've gone through something or they've had a patient in a similar experience. So I think one of the biggest challenges I see with the forums is people are afraid to ask because they won't look smart. The forum's there for us all to learn. So by asking a question, I know for me, and I'm sure for Dr. Jess, if we don't know the answer, we're going to look it up. We're going to try and find the best answer. So we're going to learn. No
question about that.
We're going to learn as much as we're going to help. So I think the more people that ask questions and start using the forum, the better it's going to be for everybody.
Exactly. And the beautiful thing, a lot of people ask me, why don't you use a Facebook group? And the problem with a Facebook group, you get instant gratification from people commenting or posting, but one, you don't know the level of credibility that who is posting, and two, maybe you posted this question on a Monday and you got some great answers, and now you can't find it, or you can't reference it, you can't search it. But on the forum, you can search, and they're there for as long as they're there. And you can read about what other people are asking and writing back, and you can post and add more information to it as well. So I agree with that comment wholeheartedly. No stupid questions at all. Be heard, because I learn a lot as well. The information that I see that people are stuck on leads me to direct where I need to be researching, right? So
Exactly.
if I'm not hearing where people are stuck, or maybe I said something in a conference which I thought was going to be very useful and effective, but it turns out to be screwing up a lot of patients, and say, hey, Dr. Lynch said this is going to be working really well, but I'm finding it's not. Well, then we've got some work to do. I've got some work to do. So hearing all these things is very, very useful.
Just remember, if you want to ask a question, you think it's stupid, just remember there's a whole mess of other people out there who have the same question.
That's right.
And Dr. Ben is absolutely correct. The difference between a Facebook group and the forum group here is that you're going to have well-experienced, well-trained physicians who have been doing this type of work for a very long time. And let's face it, on Facebook, you don't know who's answering the questions, and there's a lot of, shall we say, disputations that have no merit. Here you're gonna get the good information.
Right. Great. Well, thanks guys for your time, and see you on the forum.
You got it.
Take
Thanks,
care.
Yeah, see you guys.
Bye-bye.